In Kentucky, the opioid crisis has touched almost every community, urban and rural, black and white, Republican and Democrat.
Drug use in Kentucky is on the rise.
Kentucky will get more than $800 million to fight the opioid epidemic.
Some of the most severe devastation has been right here in Kentucky, and paramedics who used to go days without a single overdose are now lucky if they go just a few hours.
But in the face of devastation, Kentuckians are still daring to dream. They dream of healing, of justice, and of drug policy that puts the health of the community first.
Right now we are standing in part of the epicenter of the opioid crisis. Here in Eastern Kentucky and in West Virginia is the epicenter of the opioid crisis.
Here in his hometown, John Bowman has turned his private pain into public purpose.
My name is John Bowman. I am the Kentucky Senior Campaign Organizer at Dream.org.
John's working across the state to solve Kentucky's drug policies with a focus on the experiences of real people.
That was my first apartment after I got out of treatment.
I don't want to see kids today go through the same kind of hell that I went through. When we have resources available, we just have to make sure that these kids know that those resources are there, they know how to access those resources, and they're utilizing these mental health professionals and substance use professionals to make sure that they don't end up needing to go to treatment in their mid-30s to overcome a 2.5 decade long drug addiction. If incarceration worked, we would have solved this a long time ago, because Kentucky has one of the highest incarceration rates in the country. If Kentucky was a country by itself, we'd be number 7 in the world in incarceration.
I would like the lawmakers in Kentucky to know that there's a whole generation of people affected by the opioid crisis who are out here and they feel forgotten, and they feel like there are no resources and there's no assistance. There are plenty of us out here, working to change that, but I think lawmakers really need to know that a huge portion of their population is suffering. And the thing that I would like them to do is to finally, once and for all, decriminalize the disease of addiction. Everybody deserves a second chance. Everybody deserves to be recognized.
My dream for Kentucky is that we end up leading the country and the world in recovery and harm reduction. I want us to be a leader in the way that we spend our opioid abatement funds. I want the rest of the country and the world to look at us and be like, yes, they got it right.
At every stop along the tour, the message was clear. Public health is public safety. Whether it was sharing the impact of policies, providing fentanyl test strips, connecting people with resources, or breaking down key pieces of legislation, this is policy in action. When we change laws rooted in fear, when we fund healing instead of incarceration, when we bring people to the table who have been locked out for too long, we make the American dream more accessible to all.